First Aid, builds upon what you learned in the primary care course. In that course, you learn to give aid for medical emergencies that are immediately life-threatening. Emergency First Response Primary Care, CPR, and Secondary Care, First Aid courses follow emergency considerations and protocols as developed by the various members of ILCOR, the International Liaison Committee on Resuscitation. Although Emergency First Response is an internationally based course, local variation in skill technique, first aid procedures, terminology, requirements, and course flow may exist. Your Emergency First Response instructor will guide you. In Emergency First Response Primary Care, CPR, you learn 9 essential skills that link together when you help someone in a life-threatening emergency. Skill 1, scene assessment. Skill 2, barrier use. Skill 3, primary assessment. Skill 4, CPR, chest compressions. Skill 5, CPR, chest compressions combined with rescue breathing. Skill 6, serious bleeding management. Skill 7, shock management. Skill 8, spinal injury management. And Skill 9, conscious and unconscious choking adult. You may also learn other optional primary care skills, such as automated external defibrillator use and emergency oxygen use. In Emergency First Response Secondary Care, First Aid, you learn what to do when emergency medical services, EMS, are either delayed or unavailable. Secondary care skills include Skill 1, injury assessment. Skill 2, illness assessment. Skill 3, bandaging. And Skill 4, splinting for dislocations and fractures. This video covers the skills for both courses. After watching the skills demonstrated in the video, your instructor will have you practice the skills. After you've learned to perform and sequence the skills, you'll get to practice them in simulated emergency situations. This teaches you to adapt your emergency responder skills to real emergencies. Medical emergency arises. As an emergency responder, you know that if you assist, you can save or restore a patient's life. You can reduce a patient's recovery time. And you can make the difference between a temporary or lifelong disability. Even knowing this, sometimes people hesitate to help. Even people with CPR and first aid training. They may feel anxiety or guilt about the situation. Sometimes they're afraid they'll do the wrong thing. They fear imperfect performance or making a person worse. In some societies, people are afraid they'll get sued if the situation doesn't work out right, and there's the fear of communicable diseases. As an emergency responder, realize that none of these concerns need prevent you from helping in a medical emergency. Let's look at why. First, let's look at the fear of infection. You may hesitate because you're afraid of being infected by the person you are assisting. This is a concern, but remember your training includes learning to use protective barriers to minimize the risk of disease transmission. By using barriers, you're highly unlikely to get any disease or infection from someone you help. Second, focus on helping, not perfection. You want to do the best you can, but it's unlikely a minor error will make much difference, much less hurt or kill a patient. Focusing on perfection tends to make people hesitate in a real emergency. Do not hesitate. Help. Remember, adequate care provided is better than perfect care with help. Third, learn to trust your training. During the scenarios, you'll find that what you think you forgot comes back when you provide aid. At first, things feel awkward, then suddenly you've got it, like getting back on a bicycle after not riding one for years. Remember this feeling. You can trust it in a real emergency. Fourth, be decisive and act. Usually there's more than one right way to handle the situation. Circumstances don't always provide clear direction. Start helping immediately. To help you be decisive and act, Emergency First Response has developed an easy-to-use prompt to remind you of the important steps needed to assist someone in need. The Emergency Care at a Glance Decision Guide provides you with comprehensive primary and secondary care directions. This is a must-have addition to your first aid kit at home and on the road. Fifth, you may be concerned about your responsibility when helping another in need. You may hesitate because you're afraid of being sued. In general, the fear of being sued should not stop you from providing emergency care. Many countries have Good Samaritan laws which simply say that as a layperson helping another, you cannot be successfully sued if ultimately things don't work out well for the patient. Your training in this course will show you how to provide help within the protection of these laws. Good Samaritan laws will generally protect you if you provide care within the scope of your training as an emergency responder. Ask for permission to help. Act in good faith. Are not reckless or negligent. Act as a reasonably prudent person would. And don't abandon the patient once you begin care. The exception is if you must do so to protect yourself from imminent danger. Finally, don't worry about making a person worse. The most serious medical emergency is when a patient is unresponsive and isn't breathing normally. Sometimes people hesitate to help such a patient, fearing they'd make him worse. As an emergency responder, realize that you cannot make such a person worse. A person who is unresponsive and isn't breathing normally is already in the worst state of health.
Hey, I need some help here.
Again, remember you cannot make the person worse, but you may be able to help this person.
Call for help. I'm bringing AED. He's not breathing.
You don't need to fear providing rescue breaths and chest compressions. You can trust your training. Take a moment to relax, think of your training, then step forward and help. CPR, cardiopulmonary resuscitation, helps to oxygenate the body when the heart isn't beating. You do this because if CPR begins soon enough and if emergency care arrives quickly, then it may be possible to restart the patient's heart. CPR won't usually restart the patient's heart. Instead, it extends the period during which it may be possible to restart the heart.